Hi, and welcome to another edition of A Lot of Help. I'm James Lott Jr., certified life coach, former nurse, and one of your hosts of just life itself. And I have a great guest, as you can see next to me. So he has a long bio of just great credits, but I'm just going to read kind of basically what he does and what he has. Columbia University, University of Florida, multiple award winner, honor student, has many celebrity clients. Also board certified surgeon with specialty in facial plastic surgery, hair transplant, and injectables. He's also Greek, which I love my Greek folks. And he got a great smile. And I'm going to say his name, Dr. Demetri Arnaoutakis. How are you,
Awesome.
Dr. Demetri?
Great. Thanks so much for having me on. Happy to be here.
Well, first of all, I have to ask, how are you doing with this whole pandemic, the virus, the self-isolation, all that kind of stuff? How are you doing?
Yeah, this is just such a crazy time we're living in. So we have obviously closed our offices down. We've received mandates, actually. So I have offices in both Beverly Hills, California, Tampa, Florida, and then I'm also director for a medical spa in Dallas, Texas. And all of our medical boards have really issued mandates to shut down elective procedures, which includes, of course, cosmetic surgeries, injectables, pretty much everything that I do. And that's, of course, the right thing to do. The way to combat this is truly, self-quarantining and social distancing. So I've been trying to adhere to that as much as possible. Of course, I mean, I'm an active guy. I've been getting out for runs, getting some vitamin D, and seeing some sun. But yeah, it's crazy. I have actually two older brothers who are both surgeons. My oldest brother is a heart surgeon. My other brother is a vascular surgeon. And so a lot of their surgeries are actually can be urgent. So they're still working in the hospital, and God willing, they'll stay safe from everything that's going on.
God bless them for doing it. I mean, to all of the healthcare workers out there,
I'm sure a lot of your old colleagues are nurses. At the front line and all this too. So yeah, it's just sad and difficult, and hopefully we can beat it soon.
And get back to the life at hand. I know. I would say this is the temporary normal. I say it's not the new normal; it's the temporary normal. We're gonna work it out.
Yeah.
But I mean, I was reading your bio. I mean, like you seriously. I mean, everywhere you went to school, I mean, you did sports, but also maintain your grades. So where you graduate cum laude at one place, you're honor student at another. Were you always this kind of driven kind of person?
I've gotten beat down from my older brothers and really followed in their footsteps. And our mother was a school teacher, so always stressed us the importance of education. And so I always was a hard worker. There's always sure smarter kids out there, but I was always driven and motivated, whether it was in playing soccer in college or in medical school and after medical school. So that's always just been a part of me, and I've always pushed myself to try to excel in whatever I'm doing.
How'd you choose? I mean, when you go into medical profession, there's a million directions you can go. I used to work in geriatric nursing. My specialty was with older people. I love older people. But there's a million ways you can go. So you went the route of face, neck, that direction. How did that interest you?
Yeah, when I actually worked at Johns Hopkins Hospital for a year, kind of focusing on head and neck cancer reconstruction. And there was a patient there who actually, unfortunately, had cancer of her ear and had to have the ear removed to get rid of the cancer. The doctors there harvested rib cartilage. They implanted it in her forearm to let skin grow over it, and then with microvascular surgery, then reimplanted it to her ear. And it was just, I remember thinking this was so wild. It was rewarding and fascinating. And ever since then, I've kind of gone down the route of focusing on the face and the neck. When I was in Dallas, I kind of transitioned a little bit more into aesthetics, but still, it's just been a really fun, rewarding career path. And honestly, this last couple of weeks of social isolation has reminded me of how passionate I am about what I do.
Isn't that funny? That's kind of very, very interesting. I mean, I feel like this time period, there's a meme out there. It's like, we're getting told to sit down, for a second, go in the corner and think about what you did or something like that. And it's kind of like a lot of us, I mean, I love what I do. That's why I'm doing these interviews. I'm like, I can't do them in studio. I can't do them here, but I can do them from home. I got technology. I got ring lights. I got everything I need here. And I'm like, I love doing this. So it's funny you say that. I feel the same way. It's like I was reminded that I'm where I'm supposed to be. I guess that I'm where I'm supposed to be. I like it.
Yeah.
The skin. So let's talk about that. And, a lot of people, I know this from being a nurse, but a lot of people, when I said to them, well, skin is the largest organ, people go, what? So can you talk about that?
Yeah.
They see skin as skin. They're like, what the hell?
Yeah. So, I actually, and since having transitioned to California, have even started I grew up in Florida, humid weather here, and really, fortunately, with my Greek background, I've always had kind of tan skin and never really had issues. But it affects, more people than we realize, whether it's something like rosacea or eczema or psoriasis, conditions like that. So I think maybe before we even delve into some of those conditions, it's important for people to take care of their skin. And during this time, we're going to be at home a lot. So it's a good time to sort of restore and re-energize our focus there. So at the very least, for someone who has dry skin, I certainly would encourage them to use like a quality moisturizer that can help soothe and repair dry, itchy skin. There's obviously, you can buy them online, go Kiehl's, Certifed, you name it. There's tons of good lines out there.
Yeah.
And again, those just help retain moisture in the skin, and it protects it from kind of environmental influences.
Because the thing is, your skin is the first line of anything. It's out there, and so and people need to take care of it. And I mean, I know with dry skin that's fine. Now with oily skin, what should people do?
So oily skin, I encourage people to use a cleanser, a toner, and they should moisturize, twice a day or so. But the cleansers that have sulfur or salicylic acid, those are great. Those actually help dissolve excess sebum on the skin, so it helps not have as much sweat there. And glycolic acid is a good ingredient to look for in those products because it helps improve the skin's overall tone and texture.
Wow. So even with oily skin, you should still moisturize. I don't think I realized that. You still should
Yeah.
moisturize your skin.
Yeah, for sure. A light kind of oil-free moisturizer would be best. And that's just good for the skin surface at the very end after using a cleanser and a toner.
Wow. I learned something new. What about combination skin? Because that's always the weird. I have a lot of friends who have both kind of. They're like, well, this area is dry and this area is oily and this area is fine. And
yeah, one thing to add into, so for someone who has, perhaps both conditions, is to consider like an astringent, using that maybe every other day. Because if your skin is excessively oily in certain areas, the astringent can help to kind of tighten the pores and remove the oil in those areas. And then also something to consider would be like exfoliation, perhaps like once a week. That's really good for improving your skin as well. And that helps, of course, prevent the pores from clogging.
Can you do that too much? Can you exfoliate too much?
Yeah, I would be cautious of overly doing it. Even just once a week is fine.
Okay. I know people would ask me, like, well, I did it 3 times this week. My face is falling apart. Like, we don't want you to do it 3 times a week.
Yeah.
Like once a week is fine. I think I read something somewhere where you were saying how, and I think I agree with you, that anxiety, nervousness, all those emotions can affect your skin, can't it?
That's true. From just everything from a hormonal level. I mean, a lot of females, when they're going through, if they're pregnant or sort of post-pregnancy and perimenopausal, they'll see different changes in their skin. And so it's obviously a balance of that is hormonal. So a lot of times dermatologists will see them and try to see, we'll do lab tests and check out what's going on with them. So it's important for us to control our stress. That can have effect as well, and try to find something that clears your mind, whether it's meditation or exercise. I mean, I really believe in getting out every day and getting some vitamin D is good for you. I love that. And of course it's important to
I have a giant garden. I have a giant garden in my house, so I'm always outside. Always outside.
Yeah, good. Yeah.
Now I'll ask you, so is water that important for your skin?
Yes, it's important to stay hydrated. So I commonly perform injectables like, filler, lip filler, cheek filler, what have you. And those, in the fillers, it's made of hyaluronic acid. Okay. And hyaluronic acid will bind water, and that gives, moisturizes and gives more volume. So for example, someone who has very chapped lips and they come to me and they want lip filler, I tell them, like, this will help you in multiple ways, but one is because the hyaluronic acid is good for binding water and it moisturizes. So that's why. So just along those lines, when we apply like a hyaluronic acid based balm to our skin, that's another reason why it's good for it. So yeah, it's definitely good to stay hydrated, and that'll improve the texture and the turgor to your skin too.
Actually, a question just came up for me that I think I've never asked before.
Mhm.
So injectables, that includes Botox, right?
Correct.
Okay, so injectables versus plastic surgery. I'm just kind of curious of your take on, is it case by case? Is one better than the other? I mean, actually, I've never asked that question. I'm really curious about that, actually.
Yeah, so I mean, it's certainly case by case, and they can be applied in different areas. So it just depends on what the patient comes in for and what their concern is. So if someone's bothered by wrinkles across their forehead, then I'd say, sure, Botox that's the treatment for that. Botox is a in-office procedure. It's tiny little injections and takes 10 minutes to do. But if someone has hooded eyes and they've got a excess skin here and they're having trouble seeing, then no injectable is going to help that. I would recommend to do an upper eyelid surgery to get rid of that skin. So it's certainly a case by case basis and just depends on the concerns of the patient.
Have you ever had a patient come in and say, I want injectables, and you're like, well, we're actually looking closer, you should have a lift or this, or vice versa? Have you had cases like that happen before?
Yeah, for sure, all the time. So I mean, as part of my job is to guide patients to the right treatment, and I'm here to give them my advice and what I see, and to help them choose the right treatment for them. I would never want to do something that's unindicated or would actually leave them off in a worse position. So I do a lot of under eye filler and to help kind of smooth the under eye area, but that's not the right treatment for everyone. Sometimes some people need surgery, and just because I can do the filler in the office and there's no anesthesia and it's quick doesn't mean I should always be doing it for people. So it's important as a physician, we obey our Hippocratic oath, which was first do no harm. And so, you have to really think about that from a day-to-day basis on advising people what's right for them.
You are an MD, right?
Correct.
Yeah. So folks, they are the MDs. He's a doctor. So well, I mean, sometimes it's really weird because I work in Hollywood, obviously I work in Hollywood, and you see all these shows like Botched and all these little things that go on and all these reality shows, and people have those questions like, are they really doctors? Can they I'm like, they go to medical school just like everybody else. Like they just pick the specialty later. But it's like, you went to medical school. I mean, you all the time in, didn't you?
Took, I think it was 13, 14 years in training to become a facial plastic surgeon.
And you look like you're 25. How does that happen? Like, how does that happen? I'm 50, almost 51. So I'm like,
my Greek heritage has helped keep me.
Greeks, blacks, it all works out for us. I was like, I have very few. I got few, but not that many wrinkles. I'm doing good for 50, almost 51, I think.
No, you look great.
I try. I drink a lot of water. I do moisturize, and I moisturize. But yeah, I was just curious. And so, on a side note too, you also do hair transplants too.
Yeah. Oh yeah. So hair transplants are that's a fascinating procedure too.
I'm sure.
What we do is after we numb the back of the head, we can harvest individual hair follicles from the back. And then depending on if the patient wants them at their hairline or usually in the frontotemporal area, we create tiny little recipient sites, and then we manually transplant each hair follicle into those sites. And then you wait. Unfortunately, it doesn't happen overnight, but 6 months, 9 months, 12 months later, the hairs start to regrow and there's new hair growth. And it's come a long way since the 70s, once we used to do you see the plugs and that looked silly. But now you can definitely do it in a more natural and elegant way.
I'm not just the president, I'm a client too. Yeah, I remember those commercials. I remember those commercials back when I was a kid in the 70s. I remember those commercials I remember those commercials. I do. I remember those. One of the things I want to talk to you about, because many of my listeners and followers know I had Bells Palsy a couple of years ago. I had a severe case. For most people, Bells Palsy affects around 40,000 people a year. I know when I said I had it, everybody I knew was like, I just thought you had it. I just thought you had it. Like, no one talks about it, but people get it, I guess. And most times it's you get it, you're done with it in a couple of weeks, and it's mild. But there are people, I've seen cases that are 5 years later and things like that. But for those of us who recover, and obviously I look pretty good, I recovered for the most part. I know some friends who still have deadening in the cheeks, they can't smile fully, or one eye is still half droopy. They call it kinesis and things like that. Can you do it? Well, I know it's case by case, but can you offer help for some of that?
Yeah. So one thing that those patients should certainly be in physical therapy and rehab, and retraining the muscles is a big part of it. So we always encourage our patients when I worked at a big hospital in Dallas, we had a great kind kind of neuro physical therapy team, and they really worked with the patients to help them recover. So that's one thing that should start. Another thing, actually, when we just talked about it, is interesting, is sometimes we'll inject Botox
I've heard about that.
Into the other side, and it's really just used as a temporary measure to make the face appear more symmetric. And so, again, Botox works by temporarily paralyzing or weakening muscles, and usually it lasts 3 to 4 months. And so the purpose in doing that is to give the affected side time to recover, and then eventually they wear off and they come back at the same time. Yeah. So Botox can be certainly a treatment. And then, down the road, if 12 months, 18 months have gone by and there's still no recovery, then there are certain types of surgeons who could potentially perform a microvascular procedure to resupply nerves to the affected area.
Yeah. So I just want people, my folks who watch this, there is hope for some. There's things you can do. And I heard about Botox. That was something that people were saying. I also heard that sometimes Botox injectables are good for migraines.
Correct. Yeah, it's actually approved now for migraine headaches. So if anybody out there suffers from migraine headaches, they should certainly look into Botox. It can be covered by insurance even if you go see a neurologist for it, and it can work really well. I actually perform a lot of Botox for patients who suffer from TMJ or who grind their teeth a lot. And so there's a muscle on the side of the face right here called the masseter muscle. We use it to chew, and Botox into this muscle can help kind of weaken it and lessen the load on the joints. At the same time, it actually slims the face, which a lot of people like.
I like that part.
Yeah. So, but I perform a lot of that, and it's an extremely high patient satisfaction rate with that procedure.
Wow. Okay, so now we'll go to the other fun part of this, is that you work at Beverly Hills.
Yep.
So, I'm not asking you to name names or anything like that, but when someone comes in, do you usually recognize them, or are you told who they are while they're, do you know them? Do you recognize these people or no?
So, it depends. Sometimes the staff will give me a heads up, but I've been fortunate. I have a very diverse patient, clientele in LA and Tampa, and from people young in their both male and female in their 20s up to patients in their 60s and 70s even. So it's very diverse, and I love that. It's honestly one of the best parts about my job is just interacting with so many different people, and it's a lot of them are even friends now, and so they come into the office and we're chatting for 5-10 minutes, and then we almost forget that they're there to have a treatment or follow up or what have you. So it's really rewarding and a lot of fun.
I assume, and it feels like it's a very personable service. There's doctors, but there's you're doing something that's actually cosmetic or something. It's a very personal service. You get to know them a little bit, I'm sure. And
for sure. And the nice thing too is the patients come back and they're happy, and then they bring their friend. So then they come back for their appointment, and then you probably see them a week later when they come in with their friend for their friend's appointment. And you're right. It's really it honestly can be stressful at times, because you're taking care of beautiful people and successful people, and people, sometimes a reconstructive procedure, and it's their face, and it's, whether it's their nose or their eyes or their chin. These are features that we see right away when we're talking to someone. It's not the same as a breast augmentation, where the scars, you hardly see. The breasts are covered most of the time, and the scars are underneath their fold there. Or if it's a mommy makeover, you're not really looking at those features on a day-to-day basis. So it's a very high profile territory for sure.
I liken it on a much more higher scale to hair. People get their hair done. It's you see it. You get a bad haircut, it's bad. Yeah. Everybody see it. You get your hair wrong, it's bad. But yours much higher scale than that, because it's body parts. So when you're about to go into, let's say, a surgery, not even the injectable, when you go into a surgery, do you have a routine to keep you calm and steady? Do you have a routine?
Well, one thing to keep me steady is I don't drink coffee in the morning of surgery.
Very good. Yes.
Actually, I'm not a big coffee drinker.
Me neither.
Yeah, that's one thing that I noticed in the past. I did once, and my hands were shaky. So I never I've never done that before. And what I always do the night before procedure, I'll review my notes. So obviously I document everything I do and when I see patients. And so I review what I have said prior about the patient, and then I do it again the morning of. And so everything is kind of fresh on my mind, and I know exactly what I'm doing when I'm in there. So that's kind of a little routine that I have.
Very good. Do you play music or anything while you're in there? Do you like do anything?
Yeah, I gotta play some. We change it up.
What do you play? What do you play sometimes?
Variety of music, whether it's country. I like country music.
Wow. Okay.
Today's hits going a lot. We'll have some jazz going, and then on Fridays we'll play classical music too. So it's a little bit of everything. And then if the patient's awake, we'll get their input and let the patient choose too.
That's like country. Okay, country. Didn't expect that answer. I was like, okay, well, country music in there. Who's your favorite country artist right now?
I'm big. One of my old things is Florida Georgia Line, and
Florida, of course. There you go, Florida Georgia Line, and right there, of course. Thanks for being on the show. You are amazing. Yeah. And can you tell the folks that they're, I know right now your practice isn't open, but where they can find you and find your practice when we get back to life?
Yeah, for sure. So again, I have offices in Beverly Hills, California, and Tampa, Florida. I'm also working in Dallas, Texas. People can follow me if they like on Instagram at Dr Demetri, and my website and all that stuff is linked in there. So I'd be happy to talk with anyone, and we're doing FaceTime consults Monday, Friday right now. So if anybody wants to chat and they don't, usually they're too busy to make it in, well, now's a perfect time. I'd be happy to talk to them about anything.
And folks, I will post his information on our page, A Lot of Help on Facebook. We are A Lot of Help across every streaming service that you could think of. It's there, from Spotify to Pandora to iHeartRadio. It's there. This will be on there as an audio. As video, it'll be on my YouTube channel, JLJ Media. It'll be there with all the other great interviews I get to do. And he'll be on there. But I'll make sure I share his information just in case, like I say, he's doing FaceTime consults. I mean, you have a phone, you have a tablet, something you can actually work with him to have him look at you from wherever you are and go from there. And maybe just get things in order so when times get back to the way they are, you can get ready. Yes. But thanks for being on the show.
Awesome. Thanks so much for having me. I appreciate it. Stay safe, okay?